Good morning. My name is Gary Badiga, and I am the Interim Managing Director for Free and Just. And I am here today joined by a wonderful group of storytellers here to hold Scott Perry accountable. I just really want to note the location that we're at today. We're outside of SEIU Local 668. And I just really want to note, that Scott Perry, in addition to being a member of Congress who is a co-sponsor of the national abortion ban, is a co-sponsor of the Life and Conception Act, is also terrible on labor issues. And it turns out that a lot of the elected officials that want to take away our freedoms, take away the freedom to make choices about our own bodies, our own families, and our own futures, also want to take away workplace democracy and also want to reduce the role of organized labor and the agency of workers. So this fight for abortion rights is deeply intertwined with the fight for, workplace democracy, and I just really want to highlight that as we're standing outside here today. With that, I just really want to highlight our amazing patient storytellers who are here to join us today. We have Jessica St. Clair, a patient storyteller. We have Dr. Anusha Viswanathan, a patient storyteller, as well as Veronica Ann Ray from the Abortion Liberation Fund of Pennsylvania. So with that, I'm just going to hand the mic off to one of our patient storytellers, Jessica St. Clair.
Hello, my name is Jessica St. Clair. I am a professor at Harrisburg Area Community College, and many of my students become members of SEIU, so I'm very grateful for the opportunity to speak here today. I am a mother, a biology professor, and a Central Pennsylvania resident. I've spent my career caring about science, about health, and about the people of my community. But today, I'm not here as a professor, I'm here as a patient. I've wanted children for as long as I can remember. In fact, when I was little, I wanted 6. But life had other plans, and it took much longer to get pregnant than I had anticipated. But the moment that I heard that I was pregnant was the best moment of my entire life. Love my husband, but it was the best moment of my entire life. And those early weeks were full of hope. I pictured my daughter swinging. I pictured the first moments I was going to get to see her face. We went in for an appointment, and at our ultrasound, we found that my daughter had passed away. The baby I wanted my entire life had passed away inside me, and that's a moment that a parent never forgets. In medicine, what this is called is a spontaneous abortion. And I'm saying the medical term for this as a miscarriage because this language matters. A language that is being used by politicians can be misunderstood to be other things as well. So those are not necessarily exactly the same thing, but the laws don't know the difference, and neither, it turned out, did Holy Spirit Hospital. So my care was through Holy Spirit. I am a Catholic, and my faith has been very, very important to me. But when I needed medical care to safely manage my miscarriage, I was denied mifepristone, a drug that I asked for. It's simple, it's cheap, it's a safe medication that would have allowed me to go home and pass my child naturally. I want to tell you what waiting was like. It was traumatic. The child I had wanted my whole life was still inside me, and there was nothing I could do to bring about the completion of this horror in my life. So every day was a fresh wave of grief. After 2 weeks of waiting, my miscarriage became something more dangerous. It became what is known as an incomplete abortion, meaning part of tissue that was inside me was not able to pass safely. I developed pain. I developed a fever. What could have been a safe, cheap, effective solution became a medical emergency. So in my surgery, I was followed up with weeks of treatment and recovery. Not only did it threaten my health, but it threatened my fertility, something that I desperately wanted. And to be honest, it would have cost everyone around us a lot less money to have given me a safe, effective drug. The emergency was unavoidable, and what happened to me happened right here in Central Pennsylvania. So patients are not getting the care that they need with a doctor who understands their individual medical problems. And that's the heart of what I want people to understand today. Every miscarriage, every pregnancy, every patient is different in that exam room. These situations require individual medical judgment and not blanket rules that are made by politicians and other rule makers. They do not account for my fever, for my fertility risk, and for a family's grief. And I want to say plainly that no one should have to choose. I want to say plainly, no one should have to choose between their health and the cost of their medical treatment. In a moment when Pennsylvanians cannot afford health care, this is not a time for us not to allow people to have safe, effective treatment. I'm telling this story because I believe the neighbors across Pennsylvania deserve better than this. We deserve healthcare decisions made by doctors grounded in medicine and compassion, not dictated by rigid rules that treat every patient's painful moments the same way. And we deserve trust in our healthcare system because these people have went to school and have decided to become patient advocates, and their voices are not being heard either. So I also wanted to name my daughter for you today. Her name is Catherine. Her birthday was June 22nd, and it's a day that we'll never forget. Thank you. I also want to introduce Dr. Anusha.
Thank you so much, Free and Just, for having me here. My name is Anusha Viswanathan. I'm a pediatrician. I've known since I wanted to be a doctor that the only kind of doctor I'd ever want to be is one that takes care of kids. But today I'm here as a storyteller. I had an abortion 9 years ago in Pennsylvania. It was my first pregnancy. My husband and I are both doctors. He was starting his career and I was still in my medical training. We were filled with an easy joy in those early days, a feeling that would never again be replicated with my subsequent pregnancies. The first warning sign came after some testing at 12 weeks. Being a doctor myself, I should have realized that getting a call from your OB about test results may not bode well. I just remember the wind rushing in my ears. The tests were slightly out of range. We don't know what it means yet. Don't panic. Don't panic. Blink and it was 20 weeks. I wish I remembered more about that morning. It was probably very ordinary enough that my husband and I both thought we'd go back to work after seeing and go back to seeing patients after an hour or so at my OB visit. But all that changed when the OB came into our room to tell us that our pregnancy was profoundly growth restricted. Something was very wrong. I needed amniocentesis, genetic testing, counseling, and all of it now because there was a clock in Harrisburg that was ticking as we panicked. The next few weeks were very strange. I remember feeling like one of those insects slowly trapped in amber, waiting and suffocating. And then time was up. 9 years ago, I had a D&E. Afterwards, we lay in the comfort of our own bed, in the familiarity of our own city as Pittsburgh hummed around us. I was given empathy, education, and resources. Most importantly, I was given access to safe and legal health care. And I'm so grateful to have access to competent and compassionate medical services. The diverse circumstances that lead people to seek abortions illustrates the need for reproductive freedom. It is gut-wrenching and infuriating that people like me need to be flayed open, the contents of our stories examined for veracity and worth. But here we are at this moment. My story is just one in the tapestry of abortion stories. Earlier this summer, I had the honor of bearing witness to abortion storytellers from across the United States. One such story is etched in my brain. A young man spoke about his mother, a boy really, because I recognized the childish sweetness of my own son's voice. clinging to the edge of his. 4 years ago, he found his mother unresponsive and dying because she was afraid to seek medical attention after complications after an incomplete abortion. He described feeling numb and paralyzed in the days after his mother died, until one morning he opened the door and found a grocery delivery. The final, kind, mundane, and fundamentally maternal act of love from his mom. And then he cried, and the entire room cried with him. I'm not sure anymore what will move policymakers to actually understand the highly predictable, inevitable, and needless consequences of their bad policies regulating women's health care. Will it be facts? Here they are. States with the most restrictive abortion bans have shown increased blood transfusions, ER visits, rates of maternal sepsis, lapses in state reviews, and increased maternal mortality rate. And among these statistics, a forlorn boy bringing in groceries left at the front door. It boggles my mind that laws regulating medical care seem to disregard the science and art of medicine entirely. Congressman Scott Perry is a sponsor of the Life at Conception Act, a total national abortion ban without exceptions. In 2025, he voted for anti-choice legislation designed to stigmatize abortion care and criminalize doctors. And yet, in 2022, he voted against the right to contraception, a fundamental medical safeguard against needless abortions. He voted against that. He voted against our right to birth control nationwide. Instead of addressing the challenges faced by American families and actually advancing women's health care, Republicans seem to be stuck at the A word, abortions. They only work to ban abortions nationwide and violate our personal freedoms, and not to actually advance health care or women's health care. Now more than ever, we must amplify the stories of those affected by these attacks and help people across the country understand how gutting access to abortion and reproductive care unravels lives and puts families and people in impossible and life-threatening situations. You don't need to have tragic circumstances like mine to seek an abortion, but restricting abortion access will inevitably lead to tragic consequences. Thank you for your time today, and I'm happy to pass the mic on to my fellow storyteller, Veronica.
Good morning. My name is Veronica, and I am here today representing Abortion Liberation Fund, or ALF-PA. For more than 40 years, ALF-PA has worked to protect and expand abortion access no matter a person's reason, income, zip code, or method. We were founded after politicians decided that abortion would not be covered by Pennsylvania Medicaid. And 4 decades later, we are still living with the consequences of political decisions that push care further out of reach for the people who need it most. That is why abortion access matters so deeply to me and why it matters to the people of Harrisburg. At ALF-PA, we see every day that abortion access is not just about legality. It's about whether care is actually affordable, reachable, available in the moments that people need it. It's about whether someone can make their own decision about their body and future without being blocked by cost, stigma, or political interference. Since April alone, ALF-PA has funded 500 people seeking abortion care, with an average pledge of around $300. Because resources are limited, we have had to prioritize people facing the most extreme circumstances. Since April, 88 people who called were experiencing homelessness. 95 people were experiencing intimate partner violence, and 65 were teenagers. Those numbers tell one story, but the people behind them tell many others. This month, our helpline heard from Amber, whose partner was recently deported. After he was taken, she lost her housing. Amber has Medicaid, but because of federal restrictions, she could not use her insurance to pay for an abortion. After saving what she could, she still needed to help to get the care that she had already decided was right for her. We also heard from Aaliyah, a young person who is houseless and sleeping on the streets. She had to choose between paying for an abortion and paying for a place to stay. Just $300 made an enormous difference in her life and future. These stories are a warning. When abortion access is attacked and denied, people are forced into impossible situations. Their health, safety, privacy, and economic stability, and sometimes their lives are put at risk. So today, we are here to make one thing very clear. The people of Pennsylvania deserve to have their stories heard. They deserve to have access to reproductive health care that is not only protected, but that is truly affordable and accessible in practice. And those who represent PA 10 should listen to patients. They should listen to families. And Scott Perry should understand what is at stake for our communities. ALFPA has stood in the gap for decades, and we will keep showing up. But no one should be denied care because they do not have enough money, enough housing stability, or enough political power. Thank you.
All right, with that, we'll be wrapping up the presser here. I just want to note very quickly that Free and Just is the largest network of abortion storytellers in the country, and we are really lucky that you all got to hear from a few of them today. If you'd like to learn more about Free and Just, please visit us at freeandjust.us and at our social channels at freeandjustus. And with that, want to thank our patient storytellers again. Yeah, thank you all so much for coming out and sharing your stories. So very quickly, Kendall, our social media manager, is going to do some